You feel like you don't matter, feel like your life doesn't matter, get involved.
Kia ora, Ms. TeHuia's.
Thank you.
All right, we're moving on to your second brief. Mr. Stone, Ms. Waitangi, we're about 10 minutes roughly behind, and we should be fine, but
I'll go quick.
so over to you, Ms. TeHuia's.
Thank you. Thank you. I am the claimant, Jean TeHuia's, 64 years of age of Maori descent. I am wahine Maori, a wife, mother and grandmother. I am a Maori midwife of 29 years and a registered Maori nurse of 30 plus years. I am the CEO of Ngā Maia Māori Midwives Trust and bring the collective voices and concerns to you from 300 Māori midwives across Aotearoa. I employ over 80 staff, registered nurses, midwives, kaiawhina, social workers and administrators, and they work in clinics, in Maori communities and early childcare facilities, within social housing and at Te Whare Oranga Ake, a reintegration standalone facility at the Hawke's Bay Prison. My vocation in health began in 1973 when I left secondary school and entered the Hastings Memorial Hospital hostel as a nurse trainee. My educational achievements in health education and social services include Certificate in Rest Home Management, Diploma of Comprehensive Nursing, Postgraduate Diploma of Midwifery, Postgraduate Diploma Primary Healthcare Nursing Tamariki Order, Postgraduate Diploma in Sexual and Reproductive Health, Postgraduate Diploma in Public Health, Master of Nursing, a Lactation Consultant and a Diploma in Healthcare Assessment and Auditing. I am enrolled currently in the Indigenous Doctorate Program with Te Whare Wānanga o Awanui Ārangi. My thesis, the exploitation by the New Zealand child welfare system of tamariki Māori in need of care and protection from protection to prison. I have authored and piloted the following health and social services programs for the District Health Board, Ministry of Health, Accident Compensation Commission and the Department of Corrections. The National Māori Mother and Pepe Support Program for Hapu Mama, Ministry of Health in 1994. The National Tamariki Order Ministry of Health Program in 1996. Injury Prevention Kaupapa Māori Car Seat Rental, Accident Compensation 2000. Kaupapa Māori Smoke-Free Pregnancy, Hawke's Bay District Health Board in 2002. A Kaupapa Māori Antenatal Education for Hapu Mama through the Hawke's Bay District Health Board in 2005. Kaupapa Māori Breastfeeding for Hapu Mama through the Hawke's Bay District Health Board in 2007. And Te Whare Oranga Ake, a Reintegration New Zealand Corrections Department program in 2011. This is a kaupapa Māori reintegration program for Māori prisoners prior to them being released from prison. I have co-authored the publication of 2 books on cultural safety and practice in Aotearoa, and I currently teach tūranga kaupapa, cultural safety practice and maternity care to midwifery students of the 5 current midwifery schools in New Zealand. Since 1995, I have participated as a senior Māori midwifery advisor to various government, health, social, education, justice and workforce development committees to provide advice and a Māori perspective and overview of the needs of hapu mama and tamariki Māori. I am usually the token Māori on these advisory groups. Other members are generally white, middle-aged women, most of whom are not born here in New Zealand. My concerns are often trivialised or ignored when discussing the needs of hapu mama and tamariki Māori. I am the midwife at the centre of the 2019 unsuccessful illegal attempt by Oranga Tamariki to take a newborn Māori Pepe from the maternity ward at the Hastings Hospital last year. I provide further context surrounding this illegal attempt in my confidential brief of evidence. My work in the prison includes discussions with Māori males incarcerated. The interface between state child welfare and prison is evident, as the men relay to me how their parents were state wards, how they were state wards as children, and how their children have become state wards. I am convinced that we are seeing the fourth and fifth generation of Māori children through state welfare recipients in our New Zealand prison today, and that prisoners' children are targeted specifically by Oranga Tamariki. Sadly, at the Hawke's Bay prison, we have a juvenile unit, and I know that there have been times when Dad is in one part of the prison and at the same time his son is in the juvenile unit. Many of the stories relayed to me by these male Māori prisoners, now fully tā-mukud gang members, epitomises the interface of Indigenous people in settler states, such as Canada, the USA and Australia, where the criminal justice system, social policy, poverty, marginalisation, suicide, early death and dying go hand in hand with colonisation and assimilation policies used against Indigenous people, such as Māori, by dominant self-imposed government legislations as described by Armitage and supported by Wolf. I have taken a personal interest into the policy and practices of Oranga Tamariki as a result of my doctorate studies and understand from a Māori perspective the negative effect those practices have and continue to have on Tamariki Māori. I have reviewed the following reports in response to the attempted illegal uplift of child apprehension in 2019 and agree with the views and findings in those reports. Ko te wā, whakawhiti, Māori inquiry into Oranga Tamariki. Te mura o te ahi, a whānau voice, Māori inquiry into Oranga Tamariki. Te kuhu o te manawa, Office of Child Health Commissioner 2020. He take kuhi ki, I need more Māori leo practice, the Ombudsman's report of Oranga Tamariki in 2020.
Kia ora, Mr. Huia. Because we've been able to receive the briefs in advance, some of the listing you don't have to read it all out. So
Okay.
as you go through, feel free to speak to a paragraph, or
Okay.
if that is easier.
Thank you.
And I'll probably give you a little prompt when we get towards
Okay.
20 minutes, half an hour, so that we've got.
Do you got a bell?
No.
Ring the bell.
I don't like interrupting you, but I just do want to leave plenty of time for us to have a discussion with you and for any questions that might arise from Crown Counsel. Thank you.
Okay.
Mr. Huia, perhaps that's a good time to come in and say, because we are running behind time, just get to the good bits, Aunt.
Okay. Which are the
The
good
juicy
bits?
bits. I'll leave that up
Okay.
to you as to which parts you think are the
Okay.
best bits, Aunt.
Okay. I have reviewed the State of Care 2015 report by Dr. Russell Wills, who was then the Child Health Commissioner, and he suggests that the interagency data is poor from Oranga Tamariki, and that they don't have enough data to say if children are better off in care or not. I think that's a pivotal statement. His four findings when they reviewed it were that the service had not changed within the past 5 years and still fails to meet the needs of Tamariki Māori, which is evident in the number of statistics available on children abused in care by Oranga Tamariki themselves. I reviewed the white paper for vulnerable children, and I did not agree with the methodology that they used in the findings or the recommendations of that report. I continue to disagree with this report and its recommendations for the following reasons. The principles and obligations under the treaty are not mentioned anywhere in this report, and it is the basis for children and childcare in New Zealand today. The social, cultural, economic and determinants for health outcomes that impact negatively on Māori have not been acknowledged in that child health report. And on page 6, the report draws on as heavily influenced by the experience of abuse and consequential deaths of the Kāhui twins, James Whakaruru, Celio and Olympia Applin, as named in the report. And the justification for highlighting Māori children in that report has, alongside a highly publicised media attention of the deaths of Māori children at that time, resulted in this report being racially biased and racially accommodating to the political scene. The maternity support on page 50 to 51 identified 80% of new mothers receive maternity care from DHB personnel, of which 90% of these staff, we've talked about that before, are middle-aged white women. The report recognised the ability to target screening those hapu mama and to coordinate a risk assessment and setting up of multidisciplinary teams to target those children. They also coordinated a risk alert system between Child, Youth and Family and the New Zealand Police and DHBs that specifically targeted Māori pregnant women and their unborn baby. Chapter 3 in that same report identifies 2 target groups, specifically previous encounters with child welfare under the subsequent children and targeting children pre-birth or at birth in many instances, which evidence now shows that hapu mama were overly targeted. In Chapter 4 of the Vulnerable Children's Report, it identifies children in the target populations, and that being that multi-government agencies that should, under the Privacy Information Sharing Bill, could provide information and share information regarding Māori whānau, which is often misinterpreted or incorrect, between themselves, with no means for whānau Māori to correct misinformation, and Māori are further unjustifiably served by that rule. I've read and comply with the Code of Conduct. I'll keep going through here. I am personally aware of the extent to which the legislation, policy and practice changes since 2017 and currently implemented by Oranga Tamariki continue to negatively impact on tamariki Māori who languish in care indefinitely, with no planned intervention to re-establish them with their whānau, no plan to support them, as identified by Peter Bushier in his report. I'm personally aware of the 2015 Child Commissioner report identifying a lack of transparency and accountability for tamariki Māori in state care, and he raises the issue of the number of missing children that are not accounted for and not identified. He said personally in the report that Oranga Tamariki could not tell him how 1,000 children were missing. I'm personally aware, note the Ombudsman's report 2020, that the use of Section 78 without notice is being used indiscriminately against hapu mama to remove them at the birth, and is a routine means to remove newborn babies. In the last 250 removals of newborn babies from their mothers, Dr. Bushier identified that the use of Section 78 without notice had become routine, and Oranga Tamariki were using it illegally. I have personally experienced and support the Ombudsman's report and identify that Oranga Tamariki was aware in 97% of the cases in 2017 and 2018 where a newborn baby was removed at the birth under Section 78 without notice, they had an average of 60 days prior to the birth an opportunity to explore and develop safety plans for the mother and the baby, but deliberately failed to do so. I note also from the same report that tamariki Māori pepe removed at birth from their mother is humane. It prevents them from breastfeeding and or forming positive relationship and bonding with their mother, and is a breach of human rights. The Ombudsman's report further states that the subsequent children targeted by Crown entities on behalf of Oranga Tamariki themselves, reversing the onus of proof so that the parents have to prove they are not at risk to their pepe, confounded by the fact that parents often had limited means or resources to argue otherwise. I note that in many cases where parents have had their children and babies taken by Oranga Tamariki, they have then gone on to prove themselves capable and safe to keep a subsequent baby. Their personal battle, however, to reunite with their previous removed children remains an ongoing source of stress and anxiety for them. The question must be asked, if a newborn baby is deemed safe to remain with its mother, then why are siblings not allowed to be returned to the same mother? It is my belief that this inconsistency by Oranga Tamariki discriminates Māori whānau, parents and birth mothers battling unsuccessfully for years to have their previous children returned to them from state care after they have been allowed to retain a subsequent child or children, and this completely undermines the trust and confidence of the general public in the role of the state to provide for tamariki Māori in need of care and protection. I am aware of mothers who have taken their own lives, having lost the will to live, and having lost their tamariki to state care, and have felt powerless and failed in all attempts to get them back.